My name is Jamie Lemke, and I am the rehab coordinator here at Honey Creek Health and Rehab. But I'm also an OTR. I've been an OTR for 12 years now, and I've worked in long-term care my whole time. Elderly are a very unique type of personnel to get to know. They have a lot of stories to tell, and it's always very interesting talking with them and seeing people that are still living out there independently and on their own, you know, and how they learn how to modify for themselves and what we can do to teach them to help keep them as independent as possible. Here, it's so important for elderly to continue to exercise. There's many benefits to it health-wise. It helps your cardiovascular system, it helps your circulation, it helps lower your chances of so many diseases that are out there just by keeping fit and active. And so we really try to encourage residents to do exercises. And with this individual, this lady, she is working with weights on. Now at home, you won't have therapy weights at home to work with. But having your parent or your spouse, whatever the situation might be at home, continue to exercise is really helps. It not only keeps the muscles going, like I said, the circulation, all of those type of aspects. And again, doing simple exercises, you can get exercise books at a bookstore. You don't need a therapist to teach you all of them. We can give you, by having a therapy consult, you can get specific exercises that you might need, but you don't have to have specific exercises. Talk to your doctor, say, hey, is it okay, I would like to start this exercise program I got at Barnes & Noble's, through this one book, whatever it might be. And just by doing those can really keep you more physically fit and active. This type of board is developed to try to help people relearn things that they have to do in their everyday life. We take so much for granted. And when you have an illness, especially like a stroke, where it actually takes some of your muscle function away, Parkinson's, where now you're having more rigid movements, MS, where you're having a weaker grip, things like that, those type of diagnoses, or even just having arthritis. With the arthritis, it's a lot of times hard for people when there's a flare-up. There's so much pain, it's hard for them even to open a lock. And so what we do with this is we have a tendency to work on everyday activities that they have to do in their house. So in therapy, some of the exercises we do with them are maybe may seem very simple. We're pulling pegs out of a resistive board, but what we're doing is we're actually increasing their strength so that they can use it to push this in order to exchange a toilet paper roll, which seems very easy, but if you're weak, if you have arthritis, if you have limited function, that's going to be very hard. So we're going to teach you how to compensate for that. Other things are, sometimes we might have patients do clothespins. And the reason we're having them do the clothespins is it's a lateral pinch, and that's using the side of your finger and your thumb. You use that same lateral pinch to turn a key in a lock. We're showing her in the mirror how she looks. And then we're showing her how to right herself so that she's sitting in her chair and positioned in an upright position.
So where she sees herself,
then she goes to right herself. Some of the reasons why in rehab we like to have the patients come into a kitchen-type setting, because things can change when you grow older. Once you turn 65, 90% of the population have some type of arthritis. So things that people are going to have with when they start getting more elderly is they're going to have problems opening jars. And so we can teach them different techniques to use. We can show them different gadgets that you can get to help unscrew things. Things that you can mount underneath your cabinet, and you can just put it there and turn the jar so that you can get the cover off without having to use a lot of hand strength because of the arthritis. Other reasons why we do things in the kitchen would be if you have a fractured hip or if you're now wheelchair bound due to a stroke or due to some kind of Parkinson's disease or any other kind of chronic illness. that if you're in the wheelchair, we can teach you how to modify your kitchen space to make it easier for you in the kitchen. So you can reach things out of the cabinet just by opening it and using the reacher where you won't maybe have that length because you're not standing, you're now in a wheelchair. Things like that. It can also work because with reachers, they have a little bit more where you're using your whole grip instead of, and you can use both hands if needed, if you're a little weaker, where otherwise you might be having to grab it with your hand, and if you have arthritis in your hand or it's weak, it might be harder to get that out of the cabinet. So that's some of the things we do. We can show them different ways to modify their kitchen, different ways to keep things, where to keep them on the levels in the refrigerator or on the shelving unit to make it easier for them. Some individuals, what we'll do is, if they live by themselves, a lot of times they will just have one place setting sitting at their table at all times. And with that, then they know once they've had their breakfast or whatever, they go and they wash those dishes and they put them right back there so that they're not having to reach up in cabinet space and things like that on a daily basis. Everything's right there for them. We also go into a lot of microwave cooking. We'll teach them how to do that. We'll teach them, assess their safety skills with the stove to see how safe they are using the stove, and then make recommendations from there. Sometimes patients with more dementia, we might need to turn off the stove because they're not safe with it, and then we'll try to go to the microwave cooking. Or we might try to show them different things just by using some posy grip, which is the same kind of thing that you put in your cupboards that they have out now to line their cupboards with. Having that on the shelf helps keep the food in place. Same thing by having it underneath on the tabletop and your bowl on top of it helps keep your bowl in place so that if you're only using one hand because you've had a stroke, it's a little easier. So we can go through those type of steps, see how they're going to do, make any recommendations to the families at that time for what they might need to do at the home setting. Or if we need to, we'll know that they're not safe and maybe we need to have Meals on Wheels come in or have the family prepare meals so it's easier.